Hello and good afternoon. My name is Troy. I'm going to be the nurse practitioner taking care of you during your well visit today. How are you today, Miss Lauren?
I'm doing well, thank you.
Welcome, welcome. I'm just going to get my hands washed and we're going to get everything started today. Are you having any sicknesses, illnesses, or any discomforts, anything that you'd like to specifically speak on?
No, nothing.
Okay, excellent. Well, this will be a well visit, so we're just going to kind of go over everything and get this party started. All right, first I'm going to start off by doing a blood pressure and getting you a set of vital signs. If you can please take off your jacket, that would be very kind of you. Patient is alert, oriented, responding to questions appropriately, no seeming of distress. Appreciate it from across the room assessment. And then I have a fake thermometer. If you can put this in your mouth. Thank you. And all right, it's going to get nice and tight on your arm. (118/70). That is a very good blood pressure.
Okay.
All right. I'm also going to get a quick listen to your heart and lungs really quickly, and then I'm also going to feel for your pulse in the meantime as well. All right, everything is sounding really good so far. You had a heart rate of 68 and respirators of 12, easy, even, clear. And we're just also going to start off the exam by just assessing your hands first. So, any pain or tenderness whenever I touch your hands at this moment?
No.
Okay. What I'm going to have you do is I'm going to have you spread your hands out like this and try not to let me close them. Perfect. And I'm going to have you close your hands and try to spread them. Perfect, perfect. Your hands are very well groomed. There looks to be no clubbing. Her fingers are well groomed. Skin turgor is very well. Her cap refill looks to be within 3 seconds. All right. Perfect. And then as I'm looking and assessing your skin appears to be to ethnic background. No suspicions for any type of mass or lesion. Skin is warm upon palpation as well. So we're going to do a couple other things since we already are started in the upper extremities. I'm going to have you touch your nose and then touch my finger and then touch your nose again and touch my finger again. Now we'll see how fast you can do it. Just do it as fast as you can, okay? And I'm going to move it. Good job, good job, good job. All right, and we're going to switch your other finger. Good job. Oh, don't miss it, don't miss it, don't miss it. It's right there. Good. All right, good job, good job. All right, so now we're just going to move on to your head. I'm going to have you do a big smile for me. Oh, that is a beautiful smile. That's awesome, that's awesome. And can you wrinkle your forehead like you're mad or thinking, constipated? Oh, that's a good one. I'm just messing with you. All right, I'm going to have you shrug your shoulders for me, please. Don't let me push down. All right, good job. That's a very, very good job. And then next I'm going to test your neck. I'm going to have you give me some resistance where my hand is. And then we're going to give resistance on this side. I'm going to feel your scalp. Any tenderness, any pain on any of this?
No.
As I'm assessing the scalp, there seems to be no nits. There seems to be no lumps, no masses, non-tender. So normal cephalic, atraumatic, symmetrical, no masses, no nodules noted, non-tender. Scalp is free of lesions and nits. And then we're going to go down to your ears. Are you having any difficulty with hearing at all?
No.
Okay. Excellent. I am going to do an assessment of the ears with my ophthalmoscope.
Mm-hmm.
Okay, perfect. All right, prior to that, I'm just gonna tug on the ears right here. Any pain or tenderness at all with any of these?
Nope.
All right, ears seem to be symmetric. All right, so here's my light. I'm just going to look right inside your ear. I'm gonna have you tilt your head that way just a little bit for me. All right, you do a very good job on keeping your ears nice and clean. There is no wax or cerumen, as we would like to call it. I'm able to visualize your tympanic membrane. It is pearly gray. Cone of light seems to be positioned at the 7 o'clock air. I'm able to see all bony landmarks. Your ear is very good. Doesn't look to be any foreign bodies appreciated in your ear at the moment. Sorry, I just... Okay, so your external appearance of your ears seem to be normal, symmetric, bilateral, correct placement, non-tender, no drainage appreciated, no pain or tenderness. Your ear canal was clear, which most people have cerumen. I know I usually have a lot. Cone of light was appreciated around 7 o'clock, and your hearing is intact. There was no pain even when I wiggled your ears. So next thing I'm going to look at is I'm going to look at your nose. Your nose seems to be quite symmetric. It doesn't seem to have any deviation. I'm going to have you plug one of your nares and sniff other one, and then do the other one. All right, excellent. I'm going to use the same light just to kind of get a quick assessment. I'm going to have you look up just a little bit. Perfect. Guess I should turn the light on. That would be quite helpful. All right. Excellent. Mucosa is pink, symmetric, no obvious deformities, no foreign bodies, polyps, edema. It seems to be non-tender pink, patent, septum midline, and no pain on palpation. So I'm going to have you take off your glasses 1 second for me. I'm going to press on the forehead and right underneath. Okay. You just tell me if there's any pain where I'm pressing.
Nope.
And I also have already washed my hands, as you saw. So.
Right.
All right, excellent. No pain?
Nope.
All right, sinuses, no pain on palpation. All right, let's go down to your mouth. All right, your lips, they seem to have appropriate movement. They are symmetric. There is no type of drooping. I'm going to have you stick your tongue out, just like that, yep, and move it to left and right. All right. Have you had any pain or anything concerned with that?
Nope, no pain.
No pain. All right. We're going to have you open your mouth, and I'm going to just get a quick look and assessment in there. All right. I guess I should keep turning this on. Actually, I'll use this little light of mine. I'm going to let it shine. Can you say, ah?
Ah.
All right. Tonsils are appreciated. Their uvula is midline. Teeth looked to be intact with no cavities. Appreciated. You open your mouth and say, ah. Good job, good job. All right. Hard and soft palate are appreciated as well. So your lips, moist, pink mucous membranes, no facial swelling, no tenderness. Your buccal mucosa is pink and moist without any lesions. Your gums were pink as well with no bleeding, and teeth were present in good positioning without any evidence of decay. Your tongue protruded midline with no lesions appreciated. Hard palate shape, gradually arched and continuous with the pharynx was pink. Your tonsils were 1+, and your uvula was midline with no foul odor appreciated. Good job on brushing your teeth. You keep up the good work. Twice a day, making sure you floss. Those are very important, especially as you're getting older. As a 17-year-old young lady, you continue to keep working. You know, one day you have pearly whites like me. All right. For the next assessment, I'm going to look in your eyes. So I see and I notice that you have your glasses. I'm going to keep that on. We're going to do a quick assessment of this chart. I'm sure you're familiar with the Snellen chart. And I'm going to have you cover one of your eyes. And I'm going to have you read this bottom line right here.
I see 4, 2, 6, 7, 3, 9.
Excellent. Can you uncover that eye? And you'll cover the other eye for me, please, and thank you. And we're going to read it backwards.
I see 9, 3, 7, 6, 2, and 4.
All right. That is 20/20 with corrective lenses. And as I'm looking at your eyelashes, your pupils, your eyes, they all seem to be within normal shape. No ptosis appreciated, no edema, lesions, or drainage. Then I'm going to have you take off your glasses and I'm going to do an eye exam. All right, so this is going to be a little uncomfortable. Sometimes you have that bright light. So we have a couple things we have to do for this. So first, I'm just going to test your eyes. Just look right at my nose. Perfect. Look on this other side. Okay. Pupils are equal, round, and reactive to light. I'm going to have you follow this. Don't without moving your head. Squirrel. Good job, good job. I even threw a little hardball in there just to check and make sure. I seem to have very good ocular movement. I'm going to take my hands behind your head. You tell me when they come into your line of sight.
There.
Which hand is wiggling?
On my left.
Perfect. All right, we're going to try this one more time. Tell me when it comes into sight.
There.
And tell me which hand is wiggling.
The right.
Did you just guess that? Did you know I was going to go right?
Nah, I saw it.
Okay, excellent job. All right, so next thing I'm going to do is I'm going to actually perform eye exam with our good old friend. So what I'm going to have you do is I'm going to have you sit straight and find the spot on that back wall. And what I'm going to have you do is you're going to continue to look right over there. So this is just going to be, even if you see the light, just keep looking through it and keep looking exactly where you are. Red reflex appreciated. Optic disc appreciated. Veins and arteries look to be intact. I'm going to look on this other side now. Continue to keep looking. Red reflex appreciated. And I'm just going to come a little close. Good thing I brushed my teeth today. All right. Excellent, excellent. All right. So, I would say that your perla, I'm going to take my little pen right here. And I'm going to have you continue to look at the back wall. And I'm just going to have your eyes. And now I'm going to have you look at my pen. And, okay. And your eyes are well accommodated. I forgot to test that in the beginning. But I would say Perla, you had corrective lenses, but you did have 20/20 with corrective lenses. No ptosis appreciated, no edema. The lesions, there was none. No drainage. Your sclera is white. Your conjunctiva is pink. I'm just going to have you look up. Perfect. And no pain. Eyelashes seem to be appropriate. I'm going to give you your glasses back. You have no nystagmus. Red light was appreciated bilaterally in both eyes. With the exam with me, there was no... Did you have any type of visual changes or disturbances at all throughout our exam?
Nope.
Excellent. Optic disc was visualized. There's like a creamy white color. Disc margins were clear. Vessels were normal. And artery and veins ratio is about 2 to 3. Okay. All right, so the next thing I'm going to do, actually I'm going to have you take off your glasses for one more second, my friend. I'm going to have you open your mouth, say ah, and close it. Any pain or tenderness at all in your jaw?
Nope.
Okay, so what I'm going to have you do is I'm going to have you open up your mouth and close it one more time. Any pain or tenderness at all?
Nope.
All right, I'm just going to fill a couple areas. You tell me, is there any pain or tenderness in any of these areas?
No pain.
Okay, no nodules appreciated. All right, I'm gonna have you shrug your shoulders. Perfect. Okay. There was no lymph nodes that were appreciated throughout that exam. No lymphadenopathy. And then the next thing I'm going to do is I'm going to assess your neck. So it looks to be no type of swelling. It seems abnormal. I'll have you take a swallow, please. Okay. Trachea appears to be midline. Any tenderness at all when I'm touching here?
No.
All right, it's going to feel a little uncomfortable. I'm just going to get in there a little bit tighter. Can you tuck your chin a little bit? Not that much. Just like there. Can you take a new swallow for me? Okay. Excellent job. Thank you for bearing with me throughout this process. I would say that your trachea is midline. Your thyroid, I felt, was firm with no nodules or masses appreciated. And next, I am going to assess your chest. Now, due to this exam and the nature of it being my wife, I am not going to uncover her to get a full deep assessment. But in my normal practice, I would most definitely try to get as much exposure, maintaining the comfortability of the patient and the privacy of the patient. So we're just going to assume at this point in time that she is in a gown, and I'm able to get a more thorough assessment, both from observation and from a physical assessment. So I'm going to have you sit right here, and you can almost straddle it that way. I'm going to get an assessment of your skin. Right now, I would say that I would appreciate there to be no type of lesions or anything appreciated at this moment. I'm going to have you take a nice deep breath. One more time. She has equal rise. All right. Can you say 99?
99.
99?
99.
99?
99.
99?
99.
All right. I'm just going to do a little. Okay. Can you take a nice deep breath in? Out. We're going to do this several times. Any point in time, if you feel a little lightheaded, you just feel free to let me know. Your lungs sound like you are not a smoker, my friend.
I am not.
I'm just kidding. I can't tell that, but your lungs are very good. You sound very clear throughout all. So it appears that your respirations are easy and even. They are clear bilaterally with no adventitious breath sounds, with no type of accessory muscles appreciated, no distress. Each deep breath that you took seemed to have no pain, correct?
Okay.
All right. And 99 tactile firmitus is equal bilaterally with a level of diaphragmatic dullness, which I was appreciating in the back, which I was kind of doing my tapping. That's what I was looking for. I appreciated approximately, I was going to say about T9 in her spinal process. So with her also being a young lady, it will be very important for me to additionally assess her breast. Now, once again, due to the nature of this video, I'm not going to actually pull out her breasts to assess them, but I would take my finger in a very flat palm. I would start towards the nipple, and I would do a kind of circular motion outward, and I would want to get her lying down and to see if there's any type of nodules, lumps, masses, anything of that nature. I would assess the nipple to see if there is any type of drainage, and that is the general look there. I would, of course, assess for symmetry. I would have you put your hands up in the air, and I would want to see if the breasts are symmetrical, and lean forward on hands, push your hands in together, and I will do a full assessment of the breast. But due to this nature of the video, I'm going to skip that. The next thing we're going to observe is I'm going to observe your heart sounds. If you feel comfortable, you can sit right back up on there. That will probably be the best place for you. So once again, I would look and assess visually, but we can't assess fully due to the nature of the video. And then I would have her in different positions due to the nature of my home. I don't have the 45-degree angle. So I'm going to assess and go through the best that I can with this. Some of we're going to listen to your heart lung, your heart. I'm just going to have you look up, and I'm just going to have you turn your head a little bit that way.
This one?
Yes. What I'm going to be looking for is for the jugular, the JVD. Perfect. Easily palpated. Not bounding, but definitely appropriate pulsation, and that's for the jugular position. As I was listening, I would also turn her on her left side. So, and that's where I would want to assess for her PMI as well. And from there, I would want to percuss the cardiac border if there's any type of suspicion for the heart being larger, but it's not, so we're going to move past that. So your S1, S2 were heard and visualized. Regular rate and rhythm with no S3, S4, no gallops, no murmurs, no rubs. The radial pulse was good that I felt earlier, and I'm going to feel a few more of your pulses. Your cap refill is fine. And to assess a PMI, they're usually somewhere around the mid-clavicular line, the fifth intercostal space. Generally should be about a quarter size in diameter. And at the time I did assess, I did not feel any type of thrills. So I'm just going to assess here. All right, she has 2+ pulses bilaterally. So the next thing that we would do is we would assess her abdomen. Now, in addition to this video, this is a secret, so Mr. Foley, please make sure not to share this information, but my wife just found out she's pregnant, so part of this assessment we are not going to do, but I'm just going to kind of walk through and talk you through what I would do as my assessment. So I would lay her down, and I would want to first assess the belly, see what we have. So if we can, I'm going to you can feel free to place your glasses back on, and we're going to lay down right here, just to look at the belly. So I would assess the belly. There seems to be no distension. Are you having any abdominal complaints or concerns at all? No concerns. Okay. So now that I've assessed, I'm going to auscultate just to listen. All right, bowel sounds are clear. All 4 quadrants. All right. So after assessing the belly, palpating, I would say that the belly is soft, non-tender, non-distended. I did do a little palpation, which I'm going to simulate, but not go too deep. There's no guarding. There's no type of masses or pulsations appreciated. No lymphadenopathy, and no bruits were appreciated. I would then try to assess for the liver on this side. And then I would Have her hold her finger here at the top. And I would say it's about 6 centimeters. Appreciate it. For her spleen on this side. And then I would also try to assess her kidneys as well. More times than not, they are going to be something that you probably will not be able to palpate. So at this point in time, spleen, kidneys, I'm going to say non-palpable. And then I would also want to assess the inguinal area, just out to make sure to assess for any type of nodules or anything of that nature as well. But for the nature of this exam and my wife, I'm not going to go there, but that is what I would do in progression. All right, I'm gonna have you sit back up, and here's a hand that helps sit you up. And we'll turn you over. Perfect, my friend. You're doing an awesome job. We are almost finished with our examination. I have a few more things that I have to assess. So what I'm going to have you do is I'm gonna have you actually lay back down, because I forgot there's one last thing I need to do while you're laying down, and this will be the easiest. Come here. Come here. Just had to get my dog out the way. So now what I would want to assess, I'm gonna have you scoot up and I'm gonna have you try to lay your legs straight as possible. Perfect. All right. What I want to see you do is bring your knees to your chest. Perfect. And then bring them down. And then I want to see you cross your legs both ways. Perfect. Can you point your toes forward? And can you pull them back towards your face? All right, now we're going to do all of this, and I'm just going to apply a little pressure. So I'm going to have you bend your knees and bring them up towards you. Don't let me push them down. All right, now push them out towards me. Perfect. I'm going to put your feet down right here. All right, I'm going to have you, like the abductor and adductor machine at the gym. All right, don't let me push you out. Don't let me push you in. Okay, perfect. We're going to lay your legs back down. Any pain, tenderness at all? All right, point your toes to the sky. Don't let me push them. Point them towards your face. Perfect. Now drive the car on both sides. Oh, good job. That was a good driving. And I seem to spill some water, aka Perel, the good stuff. And as I'm assessing, there seems to be no type of edema appreciated. No pain on palpation. I'm going to assess the pulses bilaterally, 2+. Oh, I guess you can't see me. I'm down here assessing the pulses. And I was looking at both of the things. So I'm going to have you sit back up, my friend.
Thanks.
All right, so palpation was non-tender. There was no edema, active and passive range of motion. We're within normal limits. Would I say a 5 out of 5 for strength? The next thing I'm going to have you do is I'm going to have you take your heel and take it down your shin. Perfect. And then do the other one as well. Right. I'm going to have you close your eyes, and we're going to do that one more time. Both sides. A little bit more challenging, huh? All right. That was very good. And then we're going to assess. Where did my thing go? I'm going to assess all of your tendons. So what I'm going to have you do is I'm going to keep your arm nice and relaxed. All right. All right. Good job. I'm going to come down here to your knee. There we go. This one. All right, I would definitely do both sides just to make sure, but just for sake of time, we're going to say she has her deep tendon reflexes were appropriate, bilateral, I would say of a grade 2. Now I'm going to have you cross your arms in front of you. We're kind of similar. I'm going to have you push out against me. All right, pull back in towards you. Don't let me push them apart. Don't let me push them together. All right, take your arms up, take them down, take them all the way back, and all the way around. All right, range of motion, passive and active seem to be appropriate. I'm going to have you hold your arms out, push them down, push them up. All right, excellent job, my friend. And then what we're going to do is I'm going to have you stand up for me, please and thank you. I'm going to have you keep your feet there, and I'm going to have you close your eyes. I will do a test, and I will wait for 30 seconds just to see if she's doing any type of swaying. Romberg's test. All right, we're all done. We'll have you feet shoulder width apart once again. We'll have your arms out in front of you. Close your eyes. Perfect. Assessment was done. Good job. All right, and she's alert, active, oriented, appropriate for age, with no focal deficiencies, appreciated through my exam. And then the next thing I'm going to have you do is I want to see your spine. Okay, so what I'm gonna have you do, a few things. We're gonna have you take your hands down, go side to side. We're gonna have you turn without keeping your hips straight. We're gonna have you turn. All right, and then I'm now going to have you bend forward. As I'm assessing the back, there seems to be a right in line. There's no curvature appreciated. There's no change in the hips as well. You can stand up, my friend. You're doing an excellent job as we're finishing up all of this. Everything seems to be quite symmetrical. There were no type of hyperextension appreciated. Normal range of motion, strength in all extremities, bilateral. I'm going to have you walk on your heels towards me. All right, now turn around and we'll walk on your toes. All right, I'm gonna have you turn around and put one foot in front of the other, heel to toe, right in front, just like this.
Oh.
And then I'm gonna have you turn around and walk normal. Gait is normal. There seems to be no type of abnormalities. And hello, my assistant. Do I have my next appointment here? Okay. Yes, that one is already clean. We'll take care of that in a second. I'm going to have you go back out here and we're going to answer the phone calls. Thank you so much, my assistant. Feel free to let me know if my next appointment does come. And then additionally, I would want to do a female GU exam to assess for everything and make sure it's appropriate. I would not do I wouldn't do anything. Thank you for grabbing her some water. And you can feel free to sit down and hold her if you like. My assistant is very cuddly. And then for her, with being a teenager, I would assume that she is at Tanner stage 5 with no discharge, free of lesions, and no concerns of any type of sexual things, because she states to me that she is not sexually active. And there will be no speculum exam because that will be unnecessary at this time and no reason to do that. So then I would want to check the rectal part of her if necessary. And I think that is where I conclude. Do you have any questions or concerns?
I do not.
Okay, I think you did a wonderful job. I appreciate everything that you did and your time with me. I pray you have a blessed day, and my assistant is telling me it's time to go. So thank you to the Roebuck family and the doggy. Oh, and the little dinosaur said hello too. Have a blessed day.